The doctor, or Michael's urologist, was excellent with regards to giving Michael and I time to ask questions. He told us what he would recommend and what he was going to do then once Michael decided to go with the operation. He also said, have you got any questions? He didn't shoo us out. I was really pleased that he gave us time to ask questions that were bothering us or worrying us. And then he said, do you have any children? And we said yes. And he said, well, the next appointment, I'd like you to come with them. And he more or less went through the exact same thing in front of the kids and then said, now, do you have any questions? So he was wonderful, giving us time to ask the questions. And very bluntly, he said to Andrew, because you're Michael's son, you have to be tested from age 40 onwards. And it's up to you to do it. So I was very pleased that the doctor said that and that I wouldn't be the mother nagging him to have it done.
We asked for another opinion and we went to another doctor whom Jerry liked and he felt very comfortable with. And that's important too, that you get a doctor that you feel you can talk to.
The decision making basically is left up to the person. The doctor gives you all the options, but he doesn't really give you a defined answer at that point in time in our life anyway. The second doctor was a little more direct because by then the numbers had crept up a little bit more. And so he said he really didn't have much choice. It was either go for the radical prostatectomy or go into the radiation or another form of treatment.
I left it up to Michael. Whatever he decided to do, I was willing to go along with it. My initial reaction, internal ones, were ones to go and have it done ASAP. But he wanted to go and do a lot more research as to the various avenues that were open to him. And he went down to Princess Margaret for a day, and he wanted to go alone. He didn't want me with him. So he went down there, in fact, trying to find out what all the different avenues were open to him that he could avail himself of. And after a lot of research, then he said, I'm going to have it out. And I said, when? And he said, after our son's wedding, because our son was being married in the October, and this was the June, and he didn't want to do anything about it until after our son's wedding. He didn't want to ruin their big day.
The decision making was difficult because he was choosing watching and waiting, where my daughter and I, who is a nurse, really wanted to have a second opinion and get more information on how this could happen. And so finally when we got him to agree for the second opinion, and he saw that he really needed to take some action then, we thought could have provided us with more of a concrete answer so we knew which direction to take. But when you think back the way they do it, it is a good choice, leaving it up to you, because if you take the wrong one, then you can blame somebody, whereas if you go with what you want, then it's up, your decision is your decision.
I didn't know very much about prostate cancer. I didn't know much about the actual prostate. That I learned when Ron was diagnosed with prostate cancer. And I learned it from reading books written by doctors with the visual pictures in them. I didn't realize what its purpose was, the prostate. Didn't know anything about it. I knew there was a prostate, but I didn't know what its purpose was in the man's body. So I learned that.
I just asked a lot of people who were in the medical field a lot of questions. I asked the new GP about it also, and he said, you need to go and talk to anyone else, and I told him what I'd done, and he says, well, I think you've covered the bases then. Anytime anyone has come up to me and said, oh, my husband's been diagnosed with prostate cancer, I always tell them just, educate yourself, find out more about it, do a lot of reading, go on the internet, basically things that I had done, and ask a lot of questions.
Learn all you can about whatever treatment the husband or significant other is going through, what to do for it. I think information will help you, there's no question. There are support groups to go to, which I think are wonderful. There is internet, but you got to be careful not to get outdated information. And just be encouraging, don't be down, because if you're down, you're going to pull them down.
I went to all his appointments with him. I sat in the room because an extra pair of ears is very beneficial. When you're the patient and you're going to be facing something as serious as this, often you don't hear everything. So I would suggest that as couples, they go together and go into the office when the doctor is speaking, and for the spouse to take a notebook and keep a record of things that have said, because you won't remember after you come out of the room, and your husband will remember even less than what you've heard.
We would go to a support group, which we did, which was very, very helpful, and I really stress it because most of the men that are at least have been there and done it and have been able to give good advice, as we are now doing to people coming into this group.
I found them really, really good. The sessions there were very educational and beneficial to me. So I've always encouraged people to go there. I'm sure there's other places that they could go to, but this is the one we found, and both of us really find it very beneficial.
Don't read everything on the internet that you can find. Look for the books that the doctor recommends for you to read. And we have passed our 2 books along to many, many people for them to read, to get a feel of things and what's out there.
Yes, it would have been very good to have more information beforehand, but then again, you get so much information that you're in overload and you really don't know what. Sometimes it's better not to have too much information, just the main central facts.
The knowledge about prostate cancer, we hadn't got that much beforehand. I had a little bit because of my father's exposure with it, but we sort of, when he was diagnosed with, we sat down, we said, this is what we're going to do. We're going to try and find out as much as possible. So I think we covered the bases once we knew what we're dealing with. I can't say that I wish that I'd known these things beforehand. No, he told us what the negatives were, what the positives were, what to expect and what to do, you know. So I think we were both educated before the operation as to what to expect. So we didn't have any horror stories after the operation.